Okay, Doctor, we're ready.
Oh, yes, hello. This is Dr. Frank, and I will be talking about cocaine toxicity. But first, what is cocaine, you may ask? Well, cocaine is a powerful and addictive drug classified by the federal government as a high abuse, high dependency risk stimulant. Cocaine elevates the levels of dopamine, an excitatory neurotransmitter associated with reward, motivation, and pleasure. It is in this elevated dopamine levels that give the characteristics of high, confidence, and energy that cocaine use induces. Cocaine does this by binding to the transporter responsible for the reuptake of dopamine, and so there is an overaccumulation of dopamine in the postsynaptic cleft of the neuron. The most common form of cocaine is in the form of hydrochloride salt, such as this. And this can be administered in a couple of ways, such as intranasally, rubbed into the gums, and or dissolved in water and injected. Another form of cocaine, also called crack, is administered through smoking. There are 3 stages of cocaine toxicity. The first stage is the early stimulation stage. How are you feeling today?
Dog. Hey.
Alright, sit down. Alright. So
I'm just full of energy.
symptoms in this phase include excitement, euphoria, twitching, high blood pressure and respiratory rate, and tachycardia. After a session of cocaine use, patients will experience a hangover. Since dopamine hasn't been reuptaken, there is a shortage of supply of dopamine. The feel-good network making users feeling down. Now onto our second stage. The second stage is an advanced stage of stimulation. Symptoms include hypothermia, irregular pulse rates, high cardiac output, and dyspnea. And eventually, patients experience seizures. The first line of treatment given to cocaine toxicity patients is benzodiazepines, or better known as BDZs. This is used to treat the symptoms of seizures, hypertension, and tachycardia. BDZs is a sedative. GABA is an inhibitory neurotransmitter. It keeps the levels of excitatory neurotransmitters in balance. Although when excitatory neurotransmitters are overactive, such as in the case of cocaine use, inhibitory neurotransmitters are easily depleted. What BDZs does is bind to a receptor called the GABA-A receptor. GABA binds to this receptor to allow chloride ions to cross the membrane potential of this neuron, making it difficult to excite the cell. BDZs promote the binding of GABA to the GABA-A receptor, allowing lower concentrations of GABA to be able to open chloride channels. Thus, seizures and hypertension and tachycardia are alleviated. Other treatments can be administered are labetalol, which blocks beta and alpha receptors. This decreases blood pressure without substantially reducing the resting heart rate, cardiac output, and stroke volume. Verapamil, a calcium channel blocker, which reduces blood pressure by relaxing the heart muscle. If patients with cocaine toxicity receive medical treatment in time, then the patient will survive. Otherwise, the patients will go into the depressive phase. In the worst case scenario, symptoms of circulatory failure, cardiac arrest, loss of vital function could eventually lead to death. Yeah, she's dead. A future direction in treatment of cocaine toxicity in patients is through the administration of purified human butyrylcholinesterase. BCHE is one of the cocaine metabolizing enzymes in humans. A study has shown that patients with lowest plasma BCHE activity tends to have the most severe medical effects. Also, in vitro studies in humans and animals have shown that enhancements in BCHE levels substantially decreases cocaine half-life. BCHE administration would have immediate effect, enhancing cocaine metabolism, and does not have any side effects nor require any immune response to be effective. Cocaine may be fun, but at the end of the day, you may become one of the fatal victims of this addictive drug. So remember, never take cocaine. Stay drug-free and have a healthy life. Can I get an ambulance? What am I supposed to do with this dead body?